of heart and lung transplant, and they always get a non-contrast CT screening for whatever. And we found incidental liver lesions, as you do. So they went to ultrasound, and given that the patient had chronic kidney disease and is a transplant candidate and had AICD, they didn't want to do MRI or CT, so we offered contrast-enhanced ultrasound. So here on the ultrasound, you can obviously see an echogenic, well-marginated, slightly lobulated nodule, several of them actually. So we're already kind of thinking hemangioma. And so we go on to contrast-enhanced ultrasound to help them confirm. And what's nice is you can actually see the reflux of contrast in the hepatic veins, or I'm sorry, in the hepatic veins, again, due to the right heart dysfunction. And then here at the end of the loop, you see enhancement of the kidney in the foreground, starting to see enhancement of the liver, and then peripheral discontinuous nodular enhancement, classic for hemangioma. We find that most of these large hemangiomas don't fill in by contrast-enhanced ultrasound. So those of you who are just starting to do CUS, don't let that dissuade you from coming down on hemangioma. There's incomplete fill-in on CEUS, much more commonly seen than on CT or MRI. And that's probably because the majority of these are likely centrally sclerosed or thrombosed. And so again, microbubbles being a complete blood pool agent, you're not going to get complete fill-in, whereas you have that interstitial extravascular phase with CT and MRI. But what was interesting is about 8 minutes in, look at the background liver on the grayscale. You guys see that?
Yes.
So if I put that side by side with pre-contrast, here's the pre-contrast liver, and here's the post-contrast liver on the grayscale, on the gray B-mode image. Any thoughts? Patient was completely asymptomatic, went home, did fine.
Gane, this is an ultrasound, so you got to take it. I have no idea.
So this is a phenomenon we've now seen 3 times, and not published in the US literature. We published a case report in Radiology. This is called persistent heterogeneous liver enhancement. It's seen in very rarely after contrast-enhanced ultrasound. No one knows what the etiology is, or the pathophysiology is. There's been no adverse outcomes, so we don't really call it a adverse event, more just a phenomenon. But using spectral Doppler, we're able to notice that there are macrobubbles, sorry, in the main portal vein that don't make it over to the systemic circulation. So what the hypothesis is that somewhere in the portal circulation, likely at the level of the small bowel, microbubbles, our contrast agent, either expand due to accumulation of non-fluorinated gas in the bubbles from the gut, or combination of bubbles that coalesce and then get trapped in the portal sinusoids, just like portal venous gas. So it looks like pneumatosis in portal venous gas, but in a completely asymptomatic patient and only seen after you inject microbubble contrast. It's seen most commonly associated with patients that happen to have colitis or enteritis, which lends it to the hypothesis that it's something happening in the microcirculation of the bowel with bubbles expanding or coalescing. This patient did not have any bowel symptoms, but if you see this, don't worry. It is a phenomenon, but not an adverse event. So persistent heterogeneous liver enhancement, and it goes away in about 24 hours.
Hey, do you think it may be related to the patient's right heart failure or no?
Well, again, it's only seen in the portal circulation. So it may be medication that they're on, but we don't see these macrobubbles in the systemic circulation. So just something that for you guys starting out in contrast enhanced ultrasound to look out for. And if you see more cases, we can do a case series in the US literature, because really only in the European literature that I've seen it.
It's a great case.
All right.